Gentlemen, let's be honest for a moment. Every man watching this thinks he knows exactly what works in the bedroom. You've got your go-to moves, the ones you've relied on for decades. But what if I told you those moves might not be hitting the mark at all? I'm talking about positions that look great in movies, but in real life, they often leave her staring at the ceiling, waiting for it to end, or worse, in actual discomfort. It's not your fault. Nobody teaches us this. But as we head into 2026, the science of female pleasure has given us a completely new roadmap. I'm Dr. Jocelyn, a board-certified urologist with 5 years of experience working with men on sexual health, intimacy, and performance. I've consulted thousands of couples, studied large-scale clinical data, and I've seen the patterns repeat again and again. Today, I want to share them with you. By the end of this video, you won't just know what positions she prefers. You'll understand the biology behind why they work, so you can adapt on the fly, maximize pleasure, and protect your own body in the process. If you're ready to turn good enough into unforgettable, hit that like button and let's get started. Before we count down the top 5, there's one biological concept you must understand. Ignore this, and none of the positions will make a difference. Here's the truth. Internal movement alone is rarely enough. In my clinic, I see men obsessed with depth, speed, and duration. They treat intimacy like a performance test, a marathon of thrusts. But research confirms that only a small minority of women reach climax through internal stimulation alone. For most women, pleasure relies on what I call the 2 pillars of sensation. The first is consistent blood flow, meaning she's relaxed enough for tissues to engorge. The second is the bridge, which is simultaneous external stimulation paired with internal connection. Biologically, the most sensitive nerve endings aren't deep inside, they're external, right at the front of the pelvis. When positions pull you away from that area, when you focus on depth over contact, you break the circuit of her pleasure. The women who report the highest satisfaction aren't with men who are acrobats. They're with men who maintain contact with the front of the pelvis while keeping rhythm inside. As we go through the list, ask yourself, which positions let you stay connected? That's the secret that makes every move in this countdown work. Position number 5, sidelying, also known as spooning. Number 5 is a position that gets a bad rap for being lazy, but it's actually a masterpiece of ergonomics. Don't scroll away thinking this is just for cuddling. When you lie side by side with your pelvises parallel, you create a shallow, gliding angle rather than abrupt depth. Biologically, this reduces the risk of cervical bumping, a common source of pain, and allows for slow, rhythmic pressure that builds intensity over time. Emotionally, it feels intimate. Practically, for older men, it's gentle on the lower back, knees, and hips, yet allows complete access for touch. Here's the secret sauce: external stimulation. With your hands free, you can reach around to caress her clitoral area, stroke her neck, or sync your breathing. If it feels awkward, use a pillow between her knees. This aligns the hips, opens the pelvic floor, and allows smoother penetration. Think of your movement as rocking, not pumping. Press your pelvis forward and use short, rhythmic motions. It stimulates external nerves while maintaining internal intimacy, low effort, high reward. This is the first position that proves the 2 pillars principle in action: consistent internal rhythm paired with external contact. Position number 4, seated edge. Number 4 is seated edge. Sit on the edge of a bed or sturdy chair and have her straddle you, facing you. Why I love this: it forces connection. Eye contact, chest-to-chest contact, and shared breathing release oxytocin, the bonding hormone, which actually makes her body more responsive. From a physics standpoint, she controls depth and angle. If deep penetration is uncomfortable, or if there's a size difference, this solves it instantly. Your hands are free to hold her hips or provide external stimulation. Because your torsos press together, you get natural friction against the front of her pelvis. Here's a tip: think roll and press, not up and down. Let your pelvises glide together rhythmically. It's less about internal friction and more about maintaining external connection. A quick question for you: where are you watching from today? Drop your city in the comments. This community is global, and I love seeing it. Position number 3, coital alignment, also known as missionary. Number 3 is often called boring, face-to-face lying or traditional missionary, but we're talking about the coital alignment technique. Done wrong, it's just you doing push-ups while she waits. Done correctly, it's one of the most reliable ways for her to reach climax. The problem with standard missionary is angle. Most men thrust past the most sensitive areas. The fix? Shift your weight forward, lower your chest onto hers. Slide slightly so the base of your penis presses against the front of her pelvis. Upgrade with a small pillow under her hips, just 2 to 3 inches. This tilts the pelvis and allows for circular, rhythmic motion instead of push and pull. She experiences continuous pressure at the sensitive external nerves with no breaking of contact. Emotionally, it's grounding. Practically, it allows kissing, caressing, and intimate connection. This position proves intimacy isn't about acrobatics, it's about rhythm and connection. Position number 2, woman on top. Number 2 is woman on top. Science confirms women love this. She controls depth, angle, and pace. Some men worry about losing control, but this is the beauty. She sets the rhythm and your hands are free to guide, caress, and stimulate the front of the pelvis. If her knees tire, let her place one foot flat on the bed. This keeps sensation and comfort. Remember the 2 pillars, internal fullness plus external friction. That's why this works so consistently. Position number 1, rear entry with a twist. Traditional rear entry misses the external hotspot. Here's how to fix it. Keep her legs closer together for snugness. Place a pillow under her hips to control depth and prevent cervical pain. One hand reaches around for external stimulation. Use slow, rolling motion, not jabbing. Glide instead of pumping. Combine internal depth with clitoral stimulation externally, the ultimate 2 pillars effect. This is not just deep penetration. It's precision, connection, and pleasure combined. Before we finish, let's address 2 positions you need to retire immediately. The standing shower scene looks sexy in movies, but slippery floors and poor angles make it dangerous. Water isn't a lubricant. It washes away natural lubrication. Acrobatic knees to ears creates an extreme angle that risks pelvic floor cramping, lower back strain, and cervix bruising. Daily plan for your next encounter. Shorten your range, stay in the outer third, and maintain contact. Use wedges, as pillows are tools, not props, to align the pelvis and reduce strain. And the 30-second breathe, pause, hold her close, and breathe together. This synchronizes nervous systems. Gentlemen, one myth I want to crush. Sex fades with age. False. The most satisfied couples are often in their 50s, 60s, and 70s, not because of stamina, but because they've learned connection over performance. Intimacy in 2026 is about dignity, comfort, and pleasure that fits the bodies you have now. You have the tools, the knowledge, and the technique. Now, create that connection. If this video helped, subscribe and leave a comment telling me which adjustment you'll try first. I read every single comment. I'm Dr. Jocelyn. Age is just a number. Vitality is a choice. Use it wisely.